Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. And I'm your moderator and narrator, Uriel Neville Riley. So welcome, YouTube. Peace. Happy Sunday. Happy Sunday. We pick up. Look at this. Page 306. All right. This is chapter 19 we have been reading from and are about to complete. So, welcome, everyone. Here we go. The middle of page 306. Heart rate and rhythm. An acceptable heart rate and rhythm are essential for proper cardiovascular functioning. See Chapter 2. A rate that is too rapid will not allow adequate filling of the ventricles, and therefore the cardiac output will diminish. In addition, rapid heart rates, shorter diastolic time periods mean less time for effective coronary blood flow and increased myocardial oxygen consumption. It is generally agreed that adult heart rates above 140 per minute, 160 over 180 in young, healthy persons, embarrass adequate mechanical function. Heart rates below 50 per minute are also generally detrimental. An adult heart rate above 100 is termed tachycardia. A rate below 50 is termed bradycardia. Rhythm irregulates represent potential interference with mechanical function and inadequate cardiac output. Therefore, constant evaluation of the ECG monitor is essential to assure that there are an acceptable heart rate and rhythm. Peace. Welcome to the YouTube live book reading. Peace on this peaceful part of YouTube where we read books and learn from masters. We are now in the thick of it. Page 306 down at the bottom. Blood pressure. Very key. Welcome. Peace. Thank you for reading with us. Thank you for the likes and subs. We're pushing towards 600. Blood pressure. Blood pressure has been discussed in Chapter 2, the basic relationship of pressure being equal to flow times resistance, P equals F times R. Be kept in mind since an increase in blood pressure can be result of increased peripheral vascular resistance as well as an increased cardiac output. It must be realized that blood flow and tissue perfusion maintain life. A blood pressure measurement does not always reflect flow and tissue perfusion in the critically ill. The heart as a pump. This function of the heart must be evaluated in the critically ill. Such evaluation depends on an assessment of 1. Myocardial contractility, 2. Ventricular preload, and 3. Ventricular afterload. These factors are discussed in detail in section 7. Perfusion. Perfusion is primarily assessed by clinical observation. Urine output is a guide to the adequacy of renal perfusion. The kidney cannot produce urine if there is inadequate perfusion, However, the lack of urine output may reflect primary kidney malfunction and not perfusion deficit, which would mean there would be a blockage in that kidney area, right? So we want to keep these things in mind when we're going through and checking the list off of what someone is able to do and someone is not able to do. So that's the critical part of being the observer, right? Yeah. That puts us into another realm when we can be the observer. So we can help others around us. Thank you so much for the likes and subs. There's this peaceful part of YouTube where we read books and learn from masters. I'm Master Fitness Trainer Uriel Riley. So thank you so much for being here. Thank you for the likes and subs. We're pushing towards 600 on this part of YouTube where we convene with peacefulness and upright righteousness. We lift one another up and we read books and learn from masters. Thank you so much. All right, here we go. Yes, kidney malfunction and not perfusion deficit. Here we go. Number 2, that skin that is warm and dry in the extremities is indicative of sufficient total body perfusion. Cold and clammy extremities are early general indicators of a precarious and perhaps insufficient general perfusion status. For all you taking notes, I hope this is big, right? Thank you so much for the like. I see the love and the hearts flutter and peace, peace. Thank you for joining us this early Sunday divine rising. So we're talking about skin right here, and perfusion, all right, of a precarious and perhaps insufficient general perfusion status. 3, capillary fill. A gross approximation of tissue perfusion is evaluated by pressing down on the nail bed and making it blanch. So we'll push down. This is what they're talking about. You push down on it, and then you see if it turns, you see the red area. Okay. Again, this is another form of palpitation, which is part of really assessing. Thank you so much, Danielle Rudolph. Highest heart love. And just having fun. We love to see you here. Peace, peace. Much love. Liz, Kev. All right. Peace, peace. Pressing down on the nail bed and making it blanch. Upon release, there should be immediate filling with a reddish pink appearance, like we were just saying. 4, sensorium may be a reflector of perfusion. The cerebral brain function consciousness is extremely sensitive to a decrease in perfusion oxygenation. A change in the state of consciousness, obtundation, confusion, agitation occurs with decrease in cerebral perfusion. 5, characterization of peripheral pulses may be helpful. In times of extreme physiologic stress, muscle and skin areas are less well perfused than vital tissues. Therefore, arteries such as radials, dorsalis, pedis, and posteriotibialis are often weak and thready, and the tissues normally perfused by these vessels are cold, blanched, and often clammy. Poor peripheral perfusion is a clinical sign that should suggest that probability of poor total body perfusion. However, one must not be misled by assuming that because the skin is well perfused, vital organs are being adequately perfused. The essentials of adequate tissue perfusion are related not only to blood volume, but to adequate red cells or hemoglobin, right? And oxygen content. An appropriate amount of protein is necessary to assure an adequate colloid or colloid osmotic pressure, COP. See chapter 29. We'll get to that, right? Serum electrolytes must be maintained within reasonable balance for adequate cellular functioning. Acid base balance is important in vascular function. Since acidemia causes profound changes in the vascular system secondary to both central and peripheral effects. These changes affect our arteriolar distribution of blood as well as the microcirculation itself. Thank you so much. Peace, highest heart love. Thank you, yes, for being in the intelligent part of YouTube where we read books and learn from masters. Thank you so much for being here. Here we go. We're on page 19. Thank you so much. And this is the high level part of YouTube. This isn't Dummyville. So, yeah, feel free to share with anyone that's intellectual. Thank you. You know, deal with low levelness. Gas exchange respiration. Top of page 308. The final step in clinical evaluation of cardiopulmonary reserves is to assess the status of gas exchange, both at the systemic and pulmonary levels. Alveolar ventilation. Alveolar ventilation is defined as that portion of the minute ventilation that undergoes blood gas exchange, i.e., the portion of ventilation that respires, assuming a constant metabolic rate and therefore a constant carbon dioxide addition to the venous blood. The arterial carbon dioxide tension, or PaCO2, is a direct reflection of the adequacy of pulmonary gas exchange in relation to blood flow. Based on this logic, the arterial PCO2 may be considered a reflection of the adequacy of alveolar physiologic ventilation. 1. An arterial PCO2 below 30 millimeters Hg is considered clinically significant alveolar hyperventilation in the critically ill. Alveolar hyperventilation is secondary to either a need for better oxygenation, a response to metabolic acidosis, or a malfunction of the CNS. Very key right there, right? Yes, that's right. I have, oh man, sacred givings and that have been given to us, and you know, always divinely guided and protected. So that's what you see is a lot of beautiful gifts from the Most High, and to be able to guide me and protect me because we're dealing with the highest levels. So when you're in this part of YouTube, you're dealing with masters. So this is all mastery work from all around the world. Thank you so much. Yeah, it's a lot. That's because I've done a lot, I've accomplished a lot. So that's why I can give you this peace now, right? And give you this information in peace because I've cultivated my world and God has put me in a position to be able to help others be a holistic healer on the real highest level. So So thank you so much for being here and reading with us. Reading books is part of a service that I give here on YouTube for free, right? We want the best for the ones we love. So here we go. It's for always for my family and my daughter, because this is about legacy. We heal the people. Two, an arterial PCO2 above 50 millimeters Hg is considered a significant alveolar hypoventilation, reflecting inadequate alveolar ventilation. This is defined as ventilatory failure, respiratory acidosis. Three, an arterial PCO2 within the 30 to 50 millimeter Hg range is considered an adequate clinical ventilatory state in the critically ill patient. Dead space ventilation. Dead space ventilation is that portion of total ventilation that does not undergo molecular gas exchange with blood, i.e., the portion of ventilation that does not respire. Increased dead space ventilation represents the need for increased work of breathing if adequate alveolar ventilation is to be maintained. At a basal metabolic rate, a normal cardiopulmonary system with a normal minute ventilation results in an arterial PCO2 of 40 millimeters Hg. In the absence of abnormal dead space, doubling the minute volume without increasing metabolic rate produces an arterial PCO2 of approximately 30 millimeters Hg. A minute volume of 4 times normal produces an arterial PCO2 of about 20 millimeters Hg. Table 19.2. Thus, a significant minute ventilation to PCO2 disparity must reflect dead space disease when metabolic function is normal. Since total ventilation is composed of two parts, gas that exchanges with pulmonary blood and alveolar ventilation, and gas that does not exchange with pulmonary blood, dead space ventilation. Thank you so much for reading with us. We're at the top of page 309. Here we go. If the dead space ventilation is significant, the organism will have to expend a tremendous amount of energy to move additional air so that a normal alveolar ventilation can be maintained. This is obviously an inefficient situation and is not well tolerated for long periods of time. A co-equal factor in the efficiency of pulmonary gas exchange is pulmonary blood flow. Inadequate pulmonary blood flow will result in increased dead space ventilation because there is inadequate blood flow through the lung to exchange with air, ventilation in excess of perfusion. All right, and here we go. This is table 19.2, says expected minute volume to arterial carbon dioxide tension relationships in the normal non-exercising woman or woman. So you'll see the normal, then the twice normal, and the quadruple normal of that MV, the minute volume, right? And PaCO2 millimeters Hg is in the middle, and then the range millimeters Hg is at the side. Thank you so much. Yes. Reading books. We know the unsmart people don't like reading books. They don't like reading at all. But this is the intelligent part of YouTube where we read books and learn from masters. So, you know, all the beauty here that you see in peace banishes evil. It banishes people that are confused. It banishes people that are not intelligent, that don't read, that aren't tapped in, that aren't masters. It just dispels them out of this corner of YouTube because they can't understand it, for one thing, and it's way above their level. This is the corner of YouTube that's for masters. So if you're not a master, we hoping you will get there. This channel will help you. And if you are any evil or are you any um, dark magic workers that aren't in the light, then this really offends you. This really does. Seeing a masterful, beautiful being giving you straight light and love and information, that will irritate anyone, especially doing it in joy. That will irritate anyone who's evil, who's not of God, who's not divine. So thank you so much for reading here with us. And if you're not divine, get out because we'll slaughter you. Here we go. Table 19.2, expected minute volume to arterial carbon dioxide tension. As see right here. Thank you so much for being here. We are in the 19th chapter of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Yes, that's right. This banishes the wicked. That's right. They have no chance because we're the real life healers, right? We're the real life light workers. So the Most High is always protecting us. Thank you so much. All right. Arterial pH. Arterial pH is a measurement of the acid base status of the blood. This must be taken into consideration when evaluating physiologic ventilation, since an acute, sudden, or recent change in the ventilatory state will be accompanied by a corresponding change in the acid base state, respiratory acidosis, and alkalosis. The arterial measurement of acidemia or alkalemia, it must not be confused with the pathophysiologic conditions of metabolic acidosis and alkalosis, which reflect the overall imbalance of acids and bases in the body tissues. Let's see, this is what we talk about being alkaline, right? I'm fully alkalined, my body, which means that I have a perfect homeostasis stasis in my acid and my alkaline energy. And that's when we're basically at optimal level. We can fight off any disease. We can run for a very long time. We have great vascularity and ventilation. So I can climb mountains, right? And just breathing. I don't need water. I can go on long runs and walks and have no repercussions, right? This is an alkaline body. What you see is top notch. So that's what we're talking about this. When your metabolic rate is up and in, perfect balance, you harmonize with the environment that you're in and you're not affected by it. So it's really, really powerful being alkaline. I've, I've been alkaline for probably most of my adult life. So that's just the way it is. I've never been overweight, never had no surgeries or anything. So that's why being a master fitness trainer, I can really, really help so many people there because I've seen so many people go through so many things and be able to help them. It's about the experience. Acidemia and alkalemia lead to changes in the vascular system and cell membranes that may result in precarious oxygenation of myocardium, brain, and other vital organs. Ding! That is majorly big, right? Yes. hmm Especially when we're talking about pH, overall imbalance of acids and bases in the body tissue. Acidemia and alkaline will lead to changes. Yeah. Period. That's very key for those taking notes. In addition, acidemia may decrease the effectiveness of various pharmacologic agents, as well as decrease the predicability with which these drugs affect target organs. Oxygenation. Bottom of page 309. Oxygenation The oxygenation status of tissues is not clinically measurable. See Chapter 6. The measurement of arterial oxygen tension levels is valuable in determining the arterial blood's potential for delivering oxygen to tissue. Arterial oxygen tension does not guarantee adequate tissue oxygenation because it is only one factor in oxygen transport. The assumption that an adequate arterial oxygen tension means that there is adequate tissue oxygenation is erroneous and dangerous. Nevertheless, inadequate arterial oxygen tension, hypoxemia, is certainly a distressing factor and one that should be supported in the critically ill patient. However, hypoxemia is not synonymous with inadequate tissue oxygenation. If the cardiovascular system is capable of making up for the hypoxemia, or if oxygen carrying capacity is increased hemoglobin, adequate tissue oxygenation can still be maintained. With the availability of pulmonary arterial blood gas measurement, further evaluation of tissue oxygenation is possible through appropriate interpretation of mixed venous oxygen tensions, arterial venous oxygen content differences, and intrapulmonary shunt measurements. There we go. See Chapter 28. And we have completed Chapter 19. Thank you so much for reading with us. If you have the vocabulary too, I will. If you don't, I will put the vocabulary in the description. Want you to have a wonderful Sunday. We did it again. First day of the week. We're at the full moon. So, reading clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Riley. Thank you so much for reading with us. Peace, peace, you too. Oh my goodness. Yeah. And divinely guided and protected. Nothing can stop us. We don't care about any of those out there that aren't doing the light work. We don't give any energy to the evil, to the negative. We give you two thumbs down. That's about all we'll give you. We won't say your name. We will definitely not like or sub. So this is for the light work. Thank you so much for being here. All my friends and family, I love you so much. Dad, thank you so much for my jerseys. I love you so much, Mom and Dad. Man, we're always wishing the best for all our family and friends. That's why we come to this peaceful part of YouTube, right? So we can just bring it all in, breathe together, read together, be peaceful, be at peace. Let's have a glass of love water, right? to all our friends and family, to the success of the day, to the moon and the sun, all the stars and ancestors. We love you so much. Thank you for all you've given us and all that is coming to us. Highest heart love. Love you. I love you. I love you. I love you. I love you. Wow, we are shaking it up on YouTube big time. Reading super high level books. Make people's with low vocabulary and dummy feels, we make them heads hurt. That's for real. Much honor and love to all the righteous, all the light workers. All right, we'll see you soon when we reconvene. We'll start up with chapter 20. Yes, yes, yes. Love to you. All right, peace. I love you. I love you. And you know, because I love me. Thank you so much. You have a wonderful day. I'll see you soon.